Anyhow, so on today's class, we will see with the first phase of the perioperative nursing care, what that is the preoperative. Okay, I'll share my slides. Okay, is it visible?
Yes, ma'am.
Okay, so these are actually
Yes,
briefly,
ma'am.
these are
Yes,
three
ma'am.
phases. Okay, so we have the preoperative, the intra and the post. Okay, so in today's class, we will see with the first one, which is called as the preoperative phase. Okay, so this what is actually a preoperative phase. It is the period in between the decisions to do the surgery and the client being shifted to the operating table. So that period, okay, so after suppose a patient who he might come depending on his condition. Okay, if it is needed, if the person come in case of emergency case and all, we don't have that much time to do for this pre-operative care. But because during that time directly we have to go to the patient needs to be shifted directly to the OT. So during those type of situation, it depends, so we don't do that much of pre-operative care because we don't have time. Okay, but usually if we are doing any form of routine surgery, that means surgery which has already been planned. Okay, suppose if you have any uh, stone in the kidney, so for removing the kidney stone, we might, the doctor, you have, you after your consultation with the doctor, he might set some specific date for your surgery. So during that time, the patient before the surgery itself, suppose 1 or 2 days before the surgery, he can be admitted to the hospital and we can start with his pre-operative care. Okay, and when does it end, this preoperative care? So till the time when the patient is shifted to the operating table, till that time it is considered as a preoperative care. Okay, so immediately when the operations process will start, so that time it will include under your intraoperative care. So preoperative, so this is what it means. It is a period between the decisions to do the surgery and when you shift the client to the operating table. Okay, so actually, as a nurse, okay, under this pre-operative, also there are so many activities which we needs to do. Okay, as a nurse, so we have so many things which we have to prepare the patient, because what happened, we cannot just directly, we cannot send any patient to the OT. Okay, so we have to do so many activities before that. We have to assess the client of what is his physical status, okay, mental status, because obviously whenever a client, even anyone also, if you are planning to go for OT and all, we have that some psychological fear, because we don't know, especially if we are going for some form of major surgery and all, so it is quite risky. So the patient also might have so many fear, anxiety and all. Okay, so we have to assess all those, and we also have to do some form of investigations also needs to be done. Then we also have to prepare the OT room, we have to prepare the patient. So all this will be seen one by one. So in this pre-operative nursing care, so you will see as a nurse what are the things you should do for your patient before he will go to any surgery. Okay, so the first thing is the physical examination or assessment. Okay, so under assessment, actually, even I think your ma'am also have already taken class on this unit on, okay, physical examination and all this. So assessment is something like we are trying to assess the condition of the patient. Okay, whenever we say assessment, it includes so many aspects. It can be a physical assessment, okay, where we will assess the individual from head to toe. Okay, so head to toe examination we will do for the individual. Then we will also do the psychological assessment, because that is also important, like I've said. Okay, so because when we assess the psychological status, what we will know what is the psychological status of the client. Okay, if he's having any form of fear, anxiety, so it is our job as a nurse, we should help to reduce his fear, anxiety. We should try to counsel him, we should try to provide some form of support to the patient. Okay, so in assessment also, first thing comes actually is history. So whenever we say history, is like you're going to ask the patient. So you're going to ask the patient related to, suppose, what is his current health status, whether he's having any form of problem. Okay, whether at present he have any form of difficulty, suppose if he's having any difficulty in breathing, or if he's, what is his health condition at present. So that is the current health status. Then allergies is also important. Suppose if the person have any previous allergies to any drug, to any food items, all those also needs to be assessed. Okay, or to any medications. So all those also we will ask in the history. Then we will also ask the patient related to any list of current medications. This is also especially important because some patient they are some medications are also there which might affect the surgical process. Okay, so and some individuals suppose who are having some thyroid complication or thyroid problem, especially this hypothyroid. Okay, so then actually they always take this medication. They used to take daily medication of this thyronorm. Okay, so what happened is thyronorm, if once individuals start with this, it needs to be taken daily. So sometime what happened in related to this type of condition, so we allow the individual to take the medication even on the day of the surgery with a little amount of water. It depends on the what type of medication the patient is needed. And there are also some medication that needs to be stopped before going to the surgery. So that's why we have to take the history of what type of medication your patient is currently taking. Okay, so that we will know whether we, because mostly what happened before any surgery, the day before, the morning of that surgery, we don't allow anything per orally, or we don't allow the patient to take any forms of medication. But there is an exception, like I've said, if the patient is taking like this type of Tylenol tablet, or if he's having any, if he's a patient with a very high blood pressure, so in that case also we need to give the tablet on the morning hours. Okay, then we will also see the, just wait 1 second. Okay, so sorry. Okay, some. Okay, so the next is, okay, we have to also ask for the patient for any history of smoking, alcohol, okay, or any substance. So all these also, they are very important history that we have to ask for the patient. Okay, apart from this also we have to ask his diet. Okay, what is his diet and what is his past history also, if he is having any past complication in any, suppose if you already undergo any form of surgery, any past complication during that surgery. So all this also it includes under the history. Okay, then next is a physical examination, okay, or a physical assessment. This one I think your ma'am have taught, yes or no? Physical
Yes,
assessment.
ma'am.
Okay, so
Yes,
that's why I
ma'am.
will not go that much in detail. And moreover, physical examination, all this. So once you come back here, okay, when you practice in the lab and when you go and to the hospital, okay, when you meet your own patient, so that time actually with practice only you'll be able to learn how to remember more, okay, related to physical examination. So here also we will also conduct, like I've said, we will conduct the head to toe physical examination of the client. Okay, also we also used to conduct this system wise also. Suppose in the respiratory system we will see then digestive, cardiovascular, so like different system also we used to do different physical examination. Okay, so this is also important because the physical examination status, based on this also will be able to know if if suppose if the individual or the client, if she is not physically, if she is not physically fit for a surgery, then sometimes we have to delay the surgery or we have to even cancel the surgery. That is the main reason why we have to check for the physical status. Okay, so to see whether he is physically fit for the surgery or not. So in that condition we need to do the physical examination. Then next is the psychological preparations. Okay, so this is very important because even so for that, in order to reduce this psychological fear, what we need actually we need to do, we have to always let the patient know. Okay, suppose if he is going to do some operation, so the day before that, it is your job as a nurse. We should let the we should explain what are the things. Okay, what is the procedure to be done for the patient. Okay, so what are the things that needs to be what are the things to be expected after the surgery. Okay, so all this we have to try and explain to the patient, because at least she will be a bit relief, right? She will know, okay, so these are the things which will happen in the operation room. Okay, so she can anticipate. Okay, so it will help her to anticipate what are the things that will come, okay, after the surgery. So we should always try to explain the procedure. Okay, so this explanation of the procedure usually it is usually done by the doctor, and even the nurses also, they can educate the patient related to the procedure. Then we should always provide psychological support. Okay, so because what happened, like I've said, and some what happened, and this fear and anxiety also, it depends from individual to individual. Suppose an individual who's going to the surgery for the first time, so the fear and anxiety will be more. Okay, because it's her first time entering the operation room. Okay, so it will be a bit, she will have lots of fear. But an individual who have already had any previous surgery, so for her the fear and anxiety might be less. So depending on this, we should have, that's why we should always first assess what is the psychological status. Then based on that, we should try to help the patient. Okay, so we should have to assess the level of anxiety. Okay, and what happens sometimes, what happened to reduce this fear and anxiety, even the day before the surgery, they used to take the patient and they used to show, they orient the patient to the, like the operation room. Okay, then the changing room. So if by doing that, they will try to reduce the fear and anxiety. Okay, so the next thing is the informed consent. Okay, this is very important. Okay, so informed consent in simple terms, what is it actually? It is like a permission you are taking from the patient. Okay, so within that informed consent, everything needs to be explained. Okay, so what is the procedure to be done, when it will be done, what is the main why we need to do this procedure or this surgery. Okay, what is the risk of the surgery. Okay, after the surgery, what are the things that can happen to the patient. So all these needs to be explained properly in an informed consent. So then only the patient will sign, as well as the guardian. Okay, so we always need to take the signature of the patient as well as the guardian. Okay, so obtain the informed consent from the patient guardian after explaining the nature of the operation. Okay, and the anesthesia, actually anesthesia, it is like we always give it in to reduce the, it, whenever we give anesthesia, it causes loss of sensation and all. Okay, or the patient becomes unconscious. Even anesthesia also, I will, in the later hours class, I will tell you we have different types of anesthesia also. Okay, and also what are the risks involved with the operation. So all these needs to be explained in an informed consent. So for this also, you don't need to worry when you go for your hospital posting. Okay, so you will be seeing each and every patient before they go for any surgery. We have that informed consent form, we used to say. Okay, so in that form, everything is, we used to, everything is written related to the procedure, when it will be done. Okay, all those. So we need to get this signature from the patient as well as from the guardian. And one thing also is very important, we should not force, okay, the patient to sign, or even the guardian. It is voluntarily. If they, and they also have the rights to cancel the operation, because it is their choice. Okay, so we cannot force them. If they don't want, if later on, if they want to change their mind, or they don't want to go for the operation anymore, so they can, they have the right to refuse. Okay, so, and we should not force them just because you want your job to be done fast. So you will tell them, okay, sign now, sign now. That should not be done. Okay, should, everything should be from their own choice. So we should not, because later on, if you force them, and if later, if anything happens to the patient, you will be in trouble. Okay, so we should never try to force. Okay, and never compel the guardian to give the consent. Okay, everything should be from their own will. And explain the complications that may occur, okay, after the operation. And obtain high risk consent. When we say high risk consent, actually it is especially, it is involved in whenever any major surgery is involved. Okay, suppose a patient going any open heart surgery, or any form of kidney transplant, or any other transplantation. So these are actually very high risk surgery. So high risk surgery means after the operations, there's even chance that the patient might even go to coma, he might even become paralyzed, he, some, in some cases, it might even leads to death. So in these type of situation, we always take this high risk consent, this one, informed consent. Okay, because so before only we let the patient as well as the family know, okay, what are the risks of that operations, then we will let them sign the high risk consent form. So even this also, even in a hospital, okay, we have separate form, we used to call it as high risk consent form. Okay, so for patient with brain surgery, heart surgery, or any form of kidney transplant, these are major surgery, so we take this high risk consent form. Okay, So the next is investigations. Okay, so before going to the operation, also at least we have to do some few routine investigation. This also it depends from patient to patient on from what are the types of surgery to be done. So depending on that, also the investigation it differs. Okay, so usually we do this complete blood counts. Here we will see the various blood investigation of the client. Okay, what is the hemoglobin level? Okay, what is the ESR level? Okay, so these also when we'll go to the when you have your posting in the hospital and all, you'll be more in familiar with all this. Okay, with an X-rays, not like okay, so like it depends if the person is doing any form of operation in different suppose a fracture patient. Okay, so if he's having any fracture in the arm, so we need to get an X-ray of the arm. So like that, the investigation is not same for everyone. So it depends also on the type of surgery to be done. Okay, ECG, which is electrocardiogram. So this is actually it helps in detecting what are the electrical conductivity of the heart. Okay, so uh, it helps in knowing what are the electrical activity of the heart. Okay, then blood grouping, this is important. Okay, especially if later on, if after the surgery, during the surgery, if any blood is needed to be transfused, if say suppose if there is any type of surgery where lots of blood is lost. Okay, so in any surgery where a huge amount of blood is lost, we need to replace that. Okay, so for that we need to do the blood transfusion. So before doing this blood transfusion, we need to get what are the blood group of the client. Then we need to also get a donor, a matching donor. So like that, we need a blood grouping. Okay, then blood glucose levels. Okay, that means your sugar level. Okay, so we this is all we have to check. Suppose if the blood glucose level of the client, if it is very low, then in that situation also sometimes we might have to cancel the surgery. Okay, so it should be at least in an average normal level, normal range. Then urine analysis. Okay, that means we'll try to examine the urine. Okay, for any form of infection. Okay, or so these are actually some of the basic investigation that needs to be done. But like I've said, it is not always same for everyone. It depends from patient to patient. Okay, so some patient they might need more investigation also than these. Okay, so next is the pre-operative teaching. So actually we here in pre-operative teaching we'll try to give some form of health education to the patient. Okay, so what are the things which we can do? First of all, we can teach them related to deep breathing exercises. Okay, so why we need to give them deep breathing exercises? This is important in order to it helps them to relax. Okay, it helps them to reduce their fear, anxiety, to reduce their stress. Okay, this is actually a very common method which we use to reduce our fear, anxiety, and all. Okay, which we take in a deep breath of okay we take in a deep breath. Okay, then we breathe out. So this is like deep breathing exercises. Then personal hygiene is also important. Okay, so we will try to educate them what are the important aspects, why they need to keep their okay they need to keep their self healthy. Okay, especially before going to any operation, all everything needs to be clean. Okay, because why we need to do, because in order to reduce any chance of having any form of contaminations or infection, so we need to keep ourselves clean. Okay, active and passive exercises. Okay, so whenever we say active exercises, means these are those exercises which the patient can actively perform without any form of help or assistance. Okay, then passive exercises, these are those type of exercises which we, the person or the patient needs some form of assistance from the nurse, or it can be even from the physiotherapist, you know. Okay, so even these exercises, so we can educate the patient. Then controls of visitors to prevent cross infection. This is important. That's why what happened if you okay if you see actually in this intensive care unit or ICU, we don't allow many patients to or attendants to come and visit, and we have some visiting hours. Why we do that? Because what happened if we allowed many people to enter, go in and out of the ICU, so many there's a high chance that so many contamination or infection, cross infection can occur. Okay, so cross infection is like suppose the visitors he might from the visitors the patient again he might get the infection, or from the patient the visitors also he might get the infection. That is called as a cross infection. Okay, so also we will educate them about the pain controls and medication. Okay, so we have so many different medications also we used to give, especially after the surgery, because usually the patient will be in a lot of pain after the surgery, so we give some pain relief medication or analgesic. Okay, Then recovery room orientation. Recovery room is actually that room where we used to keep the patient after the surgery. So after the surgery, we don't shift in the patient directly to their own room. Okay, we used to keep them in this recovery room. So recovery room, we used to keep the patient there for observation. If there is anything, any complication, so immediately also they can manage the patient. Okay, so that's why we keep them in the recovery room. The word itself, recovery, right? Then the next is the what are the post-operative therapies? Okay, post-operative therapies means like be it your medication. Okay, and what are the type of diets they need to take. Okay, it also depends from surgery to surgery. Okay, so what type of anesthesia it is given, so depending on that also their diet also would differ. So these are the pre-operative teaching that we need to teach to the patient before he go for any form of surgery. Okay, and apart from these also, we will also teach him about the procedure that needs that what are the procedure that he will undergo or what type of surgery he will undergo. So that also will come under the pre-operative teaching. Okay, so the next thing is the preparation of the patient on the evening before the surgery. So suppose the patient, he will have the surgery tomorrow. Okay, so today evening, what are the things you need to do? So first of all, you have to remove any jewelry. Okay, artificial dentures. So if you have any hearing aids, okay, so hearing aids, it can be removed on the next day itself. But suppose if his patient is putting any lipstick, nail polish, so all those needs to be removed. Okay, and especially we have to make sure, if especially if you remove any jewelry from the patient or all these dentures and all, immediately you need to hand it over to the guardian. Okay, so that if anything what happen, if anything if happens to those, okay, personal items of the patient, so that you will not be in trouble, so immediately we have to hand it over to the guardian to keep it in a safe custody. Okay, then related to the skin preparation. Okay, so skin preparation, so we have to tell the patient to take a full bath. This also depends. Okay, if the patient is, if he can do it, then he can take a full shower bath. Then after that, we also need to do removal of hair. Okay, so hair removal also need to be done, especially on the area to be operated. So depending on the area to be operated, we need to do the hair removal or we need to do shaving of that particular area. Okay, then for the gastrointestinal tract preparation, we have to keep the patient nil per orally. Okay, this is important. And every time you will hear this word NPO, NPO. Okay, so whenever you hear NPO means nil per orally, that means nothing should be allowed by mouth. Okay, so we should not allow the patient to eat anything by mouth. Okay, so suppose if the patient is planning to go for the surgery tomorrow, so the patient will be allowed to eat only till midnight. Okay, so only till midnight. Suppose only for today's till dinner he can eat. After dinner he won't be allowed to eat anything. For the next day he will not be allowed to eat anything. Okay, so cleansing enema. Okay, so enema is actually given in order to clean the bowel. Okay, so by giving enema, it helps to cleanse the bowel of the patient. Then also if you come to the diet. Okay, so a light diet in the evening before the day of the surgery. So if suppose for the if the patient is planning to go for the surgery on the next day, so for today's dinner we should give a very light diet for the client. Okay, so we should not give any form of high protein diet or anything, so we should keep it very simple and light. Okay, then fasting after midnight. So usually after 12 p.m. Okay, suppose the surgery is tomorrow, so till today, okay, till 12 only he will, after 12 p.m. he will not be allowed to eat anything. So a minimum of actually 6 to 8 hours we need to keep the patient nil per orally. Okay, prior to the surgery, it is advised to prevent vomiting. Okay, during the operation time, as well as aspiration. This aspiration is very dangerous. Okay, so because aspiration is something, if suppose if you don't keep the patient nil per orally, if you allowed him to eat, then during the operation time what happened, because what happened whenever we go into surgery, especially when the anesthesia will be given, all the muscles in our body will be relaxed. Okay, so during that time also, even the whatever must, like suppose even the muscles of the stomach also will be relaxed. So sometimes the food content, it might go, okay, it might come out and it might goes into the other parts, especially the lungs. Okay, so if the food particles, if it enters inside the lungs, so it might cause aspiration, and because of this the patient might even die also. Okay, so that's why we have to be very careful. Okay, food aspiration is a very high risk, because once it enters inside the lungs, then the person might, okay, his lungs, he might have difficulty in breathing, and sometimes it might even leads to death. Okay, So that's why we have to keep the patient nil per orally, NPO. Okay. So then what are the things we have to prepare for anesthesia? Okay, so anesthesia is that solution which we give in order to cause loss of sensation or loss of consciousness. Okay, so we have to advise the patient to avoid smoking and alcohol. Okay, and for promoting rest and sleep, so in order to, especially the day before the surgery, we can give some sedatives. So sedatives, actually these are those drugs which helps to induce sleep. Okay, so for people who have difficulty in sleeping or who have insomnia, which we used to say, so we usually advise, the doctors usually prescribe this sedatives medication. Okay, so even for the patient also, suppose in order to promote his rest and sleep, okay, so we can advise to give this sedatives. Okay, so the next is preparation of the patient on the day of the surgery. So on the day of the surgery, what you need to do first, you have to help the patient to go to the toilet and assist in mouth care. Okay, so likewise, you'll assess him to, if he can do it, he can do it by himself. But if he is not able to do it, you can assist him, or even the patient's guardian also, they can help in cleaning the patient. Okay. Then remove the hairpin, clips, ornaments, any false teeth, or if the patient is having any hearing aids, contact lenses, all those needs to be removed. Okay. Then comb the hair. Okay. So for female client, we need to comb the hair of a female patient. And if the patient is having long hair, we can braid it and we can tie it with a ribbon or gauze piece. Okay. Then if the surgery is delayed sometimes, so we have to ask the physician, okay, that means the doctor, about what are the fluids that can be given to the patient, because if it's delaying for 2 long hours, okay, so we cannot just keep the patient a nil per orally like that. Okay, sometime what happened, he might, it might have some problem again, because obviously the patient also will feel hungry, he will be too weak. Okay, so we have to give something in between. Then check the orders for bowel preparation. So if the patients, if the doctor have advice for any enema, okay, that means we will try to clean whenever, to clean the bowel or the stomach contents. Okay, then clean the operation site with soap and water, okay, thoroughly. Then dry it with clean towel and paint the area with antiseptic. Okay, antiseptic solutions, for example, simple, I'll give you, suppose the Savlon solution or Dettol liquid, all those are antiseptic. That means these are those solution which helps in the prevention of infection. Okay, so whenever we say antiseptic, means these are those which helps in prevention of infection. Okay, so stop all medications unless specifically ordered by the physicians. And if oral medications are to be given, this we have to give them with a very less amount of water. Okay, so like for some medication, like I've mentioned, so some medications we cannot stop, so only for those, and only for the exception of those we will give. Then the pre-operative medications to be given are like tranquilizers, sedatives. So these sedatives, like I've already mentioned, these are given the on the night before the surgery. So this actually helps in uh, keeping the patient relaxed, okay, reducing his anxiety, also helps in inducing sleeps. Okay, analgesics also we can give. Okay, this it helps in reducing the pain. Okay, then anticholinergic, this it helps in relaxing all the muscles in our body. That's why we give this. We usually give this on the day itself, okay, before the surgery. Antiemetic, these are those drugs which helps in reducing vomiting. Okay, then antibiotics, it helps in prevention of infections. And this proton pump inhibitors, these it helps in reducing the if example is a person is having any gastritis and all, we usually give this proton pump inhibitors. So these are actually some of the pre-operative medications to be given, okay, for the patient before he go to the surgery. Then these are just some of the pre-operative checklists, okay, where we used to, even in our hospital, okay, we have a pre-operative checklist. Okay, so this checklist is important. So by doing a checklist, we will be able to see if we miss out anything, then we will know, okay, which one we have not covered. So like we have to remove, suppose, contact lens, dentures, nail polish remove, vital signs should be checked. Okay, do you know what are vital signs? Yes or no?
Yes,
Your
ma'am.
ma'am have started or not?
Yes,
In vital
ma'am.
signs, where it includes your temperature, your pulse, respiration, your blood pressure. These are very important. Again, if suppose if you find that there is any abnormalities in the vital signs, suppose if the patient blood pressure is too high, or if the patient blood pressure is too low, then in that time also what happened, we might need to delay or postpone the surgery. Okay, so that's why vital signs is a very important indications of the patient's health status. We always have to check the vital signs. Okay, then when any preoperative lab, if any investigation needs to be done, or any abnormal values, skin preparation done, okay? History of aspirin, antidepressant, steroid. HX means history, okay? Then client teaching completed, consent already signed, NPO, the patient in gown. Okay, this gown actually actually on the day also of the surgery, before the surgery also, on the day of the surgery, we also make the patient wear the hospital gown. Okay, with that hospital gown, he will go and he will go to the operation room. Okay, then allergy and ID bands also. We if you see in the figure in the diagram that this patient is having some band, pink color band. Okay, so that band is actually, it is an identification band. So in the identification band, this is very important. Okay, so in that we have to write the name of the patient, what is his age, bed number, hospital number, what is his diagnosis. Okay, so what is the plan operation, name of the plan operation. So this is important, identification band. Then no jewelry, band, tape, voiding prior to the transfer of the patient, pre-operative medication, okay, side rails after the pre-operative. Okay, so those, whatever the patient is sitting, that is also a called as a trolley. Okay, so a trolley where we use, with the help of this trolley, we used to transfer the patient from one ward to another, or from one area to another. Okay, and this trolley, we also have the side rails. If you see those sides, okay, well, those side rails actually, it helps in prevention of any fall of the patient. So we have the side rails. So sending the patient to the operation room, okay, what you need to do, administer the pre-medication to the patient 1 hour before the surgery. We have to check the vitals before any administration of medication, especially if you're planning to administer like some medication, because please mute your microphone, okay? So we have to change the patient's dress and put on the hospital gown. We have, and on the ID band, we have to write the patient name, age, what is the ward, bed number, diagnosis, hospital number. All those needs to be put and attached to the patient. Either we can put it on the patient dress or we can put it on the patient's arm, okay? Then we also ask the patient to void just before sending the patient to the operating room. Transfer the patient on a patient trolley like is shown down. Okay, so this is another different types of trolley. Okay, so and cover him with clean sheets. Never leave the patient unattended on a trolley. It is very risky. Okay, especially if you just leave him unattended, the patient might fall. If anything happened to the patients, okay, so we have to always keep the patient attended. Okay, send the patient with all the reports, whatever it has been done or any investigation, all those also we have to send it along with the patient. Always send the patient with an attendant up to the operation theater room. Okay, we should never leave the patient alone. So we, either the attendants can go along with one nurse, okay, and the patient, so or even the helper. Okay, so we should always send the attendant with the patient. Okay, so this is actually what is it about the pre-operative care. So these are the things which we need to do whenever we send the patient to any surgery. Okay, so this actually you'll be more thorough, especially when suppose when you come back and we have your hospital duty, you'll be seeing, okay, all this thing now the nurse usually used to do before the surgery. She used to go and take the consent, she used to do the checklist, and even on the day of the surgery also the nurse, she used to administer, she will not directly administer all those medications, but she will prepare those medications and she will transfer, and she will all those medication also will be sent to the OT along with all the patient reports and all. Okay, so are you clear with preoperative care? Any question? Yes or no?
Ma'am, ma'am,
Yes.
ma'am, can you repeat in the investigation point? The point is easy.
What? Or complete blood counts?
No, ma'am, the ECG.
Or ECG is the electrocardiogram, where we usually see the electrical conductivity of the heart. You have seen or not the, if you see, what I'll say, if you see in some movies and all, we see like a wave like structure is also, it's there na, in the monitor, cardiac monitor we used to
Yes,
say.
ma'am.
Okay, that is actually the ECG. It identifies what is the electrical conductivity of the heart. Okay, so this is very important. Electrical ECG with electrocardiogram. Okay, ECG. It helps in identifying what are the electrical conductivity of the heart. So this actually when you learn about your cardiovascular system, right? So in that you will be knowing what are the all those electrical conductivity of the heart and all. Okay. Okay, fine. And even in second year also you'll have
Okay, ma'am.
separate class for all this in your medical surgical, no? Fine. Any other question?
No,
My
ma'am.
time is almost over. Okay, only 1 minute I have. Any other question? Okay, anyhow, you just go through. Then after 5 minutes, I'll again start. Okay, you please rejoin again. I will just in the next one we will discuss about the intraoperative. Okay.
Okay, ma'am.
Okay, I will stop for now. If there are any other questions, you ask me after 5 minutes. Okay, when we rejoin again.
Okay, ma'am.